In a story you will only see here, alarming numbers reveal the suicide epidemic with children and teenagers is getting worse. More kids are going to the ER for attempting suicide or seeking help because of suicidal thoughts.
Doctors diagnosed more than 1 million children or teenagers with suicidal thoughts or suicide attempts in 2015, twice the number from 2007. And as 41 Action News reporter Ariel Rothfield explains, it's impacting the metro.
Doctors and social workers here at Children's Mercy are also seeing their numbers rise, and they hope this will prompt parents to have honest conversations with their kids.
I wish I had had more conversations with Lane.
Ever since losing her daughter Lane to suicide, Jan Mars's mission has been to talk about the stigma.
If I'd known more about mental health and known the questions to ask and could have gotten her help earlier, I think it would have made a huge difference.
A difference on a problem seen daily here at Children's Mercy Hospital.
In September, we see a spike, and typically in March, April, we see a spike.
From July 2017 through June 2018, more than 1,700 patients have ended up here at Children's Mercy's emergency room for a suicide thought or attempt, a 39% increase from the year before. And the reasons are complicated.
You know, one of the things we do see is that there is a lot of pressure right now for children and youth. We're seeing a lot of pressure at school. We're seeing a lot of bullying.
Social media and increasing rates of cyberbullying might also play a part. But having a conversation can help, letting a child or a teen know they are not alone.
I do think the volume is increasing in terms of our kids that are struggling with mental health issues. The good news is, I think as we break the stigma, they're willing to say something and they're willing to get help.
Reporting in Kansas City, Ariel Rothfield, 41 Action News.
The woman you heard from there, Jan Mars, told us that if parents have to take their child to the ER for suicidal attempts, it is important to explain this is not a punishment, but a way to get them help. Reassuring your child the ER visit is important for their overall health.
And social workers and parents who've lost their children to suicide say early prevention is so important. Getting counseling at the first sign of depression can help prevent a trip to the ER. We want to show you just how big of an issue this is right now. According to research done by Boston Children's Hospital, suicide is the second leading cause of death among children, and that's including the age groups 10 to 24. It's also the third leading cause of death among 12-year-olds. Nearly 1 in 8 children from 6 to 12 years old admits to having suicidal thoughts. Depression and mental health are major issues for teenagers. 70% believe those issues are widespread, impacting everybody, regardless of race, gender, or status. According to a new Pew Research Center survey, teens admitted anxiety and depression are more significant now than bullying, drug addiction, alcohol, or teen pregnancy.
Well, some signs to watch out for include depression, pulling away from activities or friends, ignoring phone calls or text messages. Experts say when you spot these red flags, it's okay to ask them point blank, are you having thoughts of wanting to die or kill yourself? They say be clear, straightforward. All that language is best to get to the root of the problem. And depending on the answer, that's when you can decide whether or not it's important to seek help from a doctor or a therapist. We want to take a second look at this on your screen right now. It is the Suicide Prevention Hotline. There is somebody there available to speak with 24/7. The information is also available at kshb.com.